Ma'am, what is USAID's strategy on health and water sanitation and hygiene, which is in abbreviation WASH? And how is USAID partnering with Reckitt Banks on nutrition, hygiene, and sexual well-being, working with RB?
Thank you very much. A few points to add to that question, and thank you for asking that, and really happy to be here today on the panel. So USAID and the government of India, we share a development partnership which spans more than 70 years. And today this partnership really looks at ensuring that the gains that we are reaching together in development are felt amongst the people across all communities. So the focus on inclusive development. And we've adjusted our partnership to better recognize India's leadership as a major donor in its own right. So when you look at our strategy and our approach, we work really closely with the government's initiatives, very bold initiatives to improve the lives and health of people, such as has already been mentioned, the Swachh Bharat initiative, the Ayushman Bharat initiative, the health insurance plan to provide healthcare for nearly 500 million people. And so we look, again, our strategy is we look at the government commitment and the growing and active engagement of the private sector. And we work with a unique partner-to-partner model to address this. So we work with the government and a range of private sector actors. And our focus together, which is really important, is to identify, pilot, and scale up these cost-effective solutions and best practices for India's development in this sector and across all sectors. And we think this integrated approach with private sector engagement and sustainable financing, which is something I'll talk about in just a minute also, as Ravi had mentioned. It includes really strong practices in procurement. And in the WASH sector, we look to enhance the impact of our own investment and commitment with all of the partners so that we can increase access to services in India's urban WASH sector. So when you look at the partnership that we have with RB, we're really pleased about this. And we're results driven, as I think you all are as well. So we developed the first health development impact bond in Rajasthan to improve maternal and child health death rates. So unlike traditional development funding, with a development impact bond, payments are made only if measurable and verifiable outcomes are achieved. And it's innovative, sustainable, it's a market-based financing mechanism, and it takes a business approach. So together with RB and state governments of Madhya Pradesh and Uttar Pradesh, we're using this development impact bond model to improve nutrition status of 30,000 TB patients and avert 700,000 diarrheal deaths. So two areas where our work aligns really well with both RB and the state government's interests. So I'll end there, but we've got a long partnership with RB.